The head consists of the skull, face, scalp, teeth, brain, cranial nerve, meninges, special sense organs, and other structures, such as blood vessels, lymphatics, and fat. It is also a site where the food is ingested and air is inspired and expired. Because of it, the diseases of important structures in the head form the basis of many medical, dental, and surgical specialties. Dentistry, maxillofacial surgery, neurology, neuroradiology, neurosurgery, ophthalmology, oral surgery, otology, psychiatry, and rhinology. The skull is the skeleton of the head. A series of bones form its two parts, the neurocranium and the facial skeleton. The neurocranium, the brain box or cranial box, provides a case for the brain and cranial meninges, membranes covering the brain, proximal parts of the cranial nerves and blood vessels. The term cranium is sometimes restricted to a skull without the mandible. The cranium has a dome-like roof, the calvaria, and the floor or cranial base consists of the ethmoid bone and parts of the occipital and temporal bones. The facial skeleton consists of the bones surrounding the mouth and nose and contributing to the orbits, which is the eye sockets and orbital cavity. The neurocranium in adults is formed by a series of 8 bones, and they are a frontal bone, a pair parietal bones, a pair of temporal bones, an occipital bone, a sphenoid bone, and ethmoid bone. Most of these bones are largely flat, curved, and united by fibrous interlocking sutures. During childhood, some bones are united by hyaline cartilage, which is known as synchondrosis between the occipital and sphenoid bone. A number of irregular bones form the framework of the face and cranial base. The facial skeleton, the viscerocranium or splanocranium, forms the anterior part of the skull, containing the orbits and nasal cavities, and includes the maxilla and mandible. The facial skeleton consists of 14 irregular bones: the lagrimal bones, 2, the nasal bones, 2, the maxillae, 2, the zygomatic bones, 2, the palatine bones, 2, the inferior nasal conchae, 2, the mandible, 1, and the vomer, 1. The maxillae and mandible house the teeth, that is, they provide the sockets and supporting bone for the maxillary and mandibular teeth. The maxilla forms the skeleton of the upper jaw, which is fixed to the cranial base. In general, the maxillae contribute to the greater part of the upper facial skeleton. The mandible forms the skeleton of the lower jaw, which is movable because it articulates with the cranial base at the temporomandibular joints. In the anatomical position, the skull is oriented so that the inferior margin of the orbit and the superior margin of the external acoustic meatus, which is the auditory canal, of both sides lie in the same horizontal plane. This standard um, craniometric reference is the orbitamental plane, right? Take a look in your atlas just right away, right? The views of the skull, right? The adult skull, right? And the lateral view and also the inferior view. The anterior parts of the skull, right, features the anterior aspect of the skull are the frontal and zygomatic bones, the orbits, the nasal regions, the maxillae and mandibule, right? The frontal bone specifically is squamous, right, which is flat. Part forms the skeleton of the forehead, articulating inferiorly with the nasal and zygomatic bones in the fetal skull. The two halves of the front bone are separated by the frontal suture, and they remain separate until approximately 6 years of age. In some adults, the separation line persists in the metopic structure in the midline of the glabella. The smooth, slightly depressed area between the superciliary arches. A persistent metopic suture is radiographic images must not be mistaken for a fracture line. The intersection of the frontal and nasal bones is the nasion, which is most people is related to a distinctly depressed area, which is the bridge of the nose. The frontal bone also articulates with the lacrimal, ethmoid, and sternal bones, and a horizontal portion of bone, which is the orbital part, which is the palate. Of the frontal bone forms both the roof of the orbit and part of the floor of the cranial cavity. The supraorbital margin, the angular boundary between the squamous and orbital parts, has a supraorbital notch of a foramen in some skulls. For passage of the supraorbital nerves and vessels. Just superior to the supraorbital margin is a ridge, the superciliary arc, that extends laterally on each side from the glabella. The prominence of this ridge, deep to the eyebrow, is generally greater in males. Within the orbits are the superior and inferior orbital fissures and optic canals. The zygomatic bones, the zygoma bones, the cheekbones, the malar bones, forming the prominence of the cheeks, lie in the inferolateral sides of the orbits and rest of the maxillae. The anterolateral rims, wall, floor, and much of the infraorbital margins of the orbits are formed by these bones. A small zygomatic facial foramen pierces the lateral aspect of each zygomatic bone. The zygomatic bone articulates with the frontal sphenoid and temporal bones and maxillae. Inferior to the nasal bones are the pear-shaped periform apertures or the anterior nasal apertures. The bony nasal septum can be observed throughout this opening, dividing the nasal cavity into right and left parts. On the lateral wall of each nasal cavity are curved bony plates and nasal contours. The maxilla form the upper jaw. Their alveolar process includes the sockets and constitutes the supporting blood for the maxillary teeth. The maxilla surrounds most of the piriform apertures and forms the supraorbital margins medially. They have a broad connections with the zygomatic bones laterally and have an infraorbital foramen inferior to each orbit for the infraorbital nerves and vessels. The two maxillaries are united at the intermaxillary suture in the median plane. The mandible is a U-shaped bone with the alveolar process that houses the mandibular teeth. Inferior to the second premolar teeth are the mental foramina for the mental nerve and vessels. The mental protuberance forming the prominence of the chin is a triangular elevation of bone inferior to the mandibular symphysis, the region where the half of the spiral mandible fuses. The mandible is described in more detail later. Take a look in your atlas, the anterior view of the skull, and also take a look at the lateral view, right, of the skull. Looking at the lateral aspects of the view of the skull is formed by cranial and facial bones. The main features of the cranial part include the temporal fossa, the opening of the cranial acoustic meatus, and the mastoid region of the temporal bone. The main features of the facial part include the infratemporal fossa, the zygomatic arch, and lateral aspects of the maxilla and mandible. The temporal fossa is bounded superiorly and posteriorly by the temporal line, and anteriorly by the frontal and zygomatic bones, and inferiorly by the zygomatic arch. The superior border of this arch corresponds to the inferior limit of the cerebral hemispheres of the brain. The zygomatic arch is formed by the union of the temporal process of the zygomatic bone and the zygomatic process of the temporal bone. In the anterior part of the temporal fossa is 3 to 4 centimeters superior to the midpoint of the zygomatic arch is the clinically important area of bone junctions, the pterion. It is usually indicated by the H-shaped formation of the sutures that unite the frontal parietal sphenoid. Less commonly, the frontal and temporal bones articulate. Sometimes all four bones meet at a point. The external acoustic opening is the entrance to the external acoustic meatus, which leads to the tympanic membrane, the eardrum. The mastoid process of the temporal bone is posterior to the opening of the external acoustic meatus. Anteromedial to the mastoid process is the slender sphenoid process. The mandible consists of a horizontal, let me correct this one. The anteromedial to the mastoid process is the slender styloid process. The mandible consists of a horizontal part, the body, and a vertical part, the ramus. The infratemporal fossa is an irregular space inferior and deep to the zygomatic arch and the mandible and posterior to the maxilla. The posterior aspect of the skull, or occiput, is typically ovoid or round in outline. It is formed by the occipital bone, part of the parietal bones, and mastoid part of the temporal bone. The external occipital protuberance, also known as the inion, is usually an easily palpable elevation in the median plane. However, occasionally, especially in females, it might be inconspicuous. The external occipital crest descends from the external occipital protuberance toward the foramen magnum, the large opening in the basal part of the occipital bone. The superior knuckle line, marking the superior limit of the neck, extends laterally from each side of the external occipital protuberance. The inferior knuckle line is less distinct in the center of the occiput. The lambda indicates the junction of the sagittal and lambdoid sutures. The lambda can sometimes be felt as a depression. One or more sutural bones, right, accessory bones might be located at the lambda or near the mastoid process of the temporal bone. The superior aspect of the skull, usually somehow oval in form, broadens posterolaterally at the parietal eminence. In some people, the frontal eminence are also prominent, giving the skull an almost square appearance. The bones forming the calvaria are visible from this aspect. The frontal bone anteriorly, the right and left parietal bones laterally, and the occipital bone posteriorly. The coronal sutures separate the frontal and parietal bones. The sagittal suture separates the parietal bones, and the lambdoid suture separates the parietal and temporal bones from the occipital bones. The brecma is the landmark formed by the intersection of the sagittal and coronal sutures. The vertex, the most superior point of the skull, is near the midpoint of the sagittal sutures. The parietal foramen is a small inconstant aperture which might be paired, located posteriorly in the parietal bone near the sagittal suture. The parietal foramen transmits an emissary vein connecting the skull to a venous sinus of the cranial cavity. The external aspect of the cranial base, the external surface of the cranial base shows the alveolar arc of the maxillae, which is the free border of the alveolar process surrounding the supporting the maxillary teeth, the palatine process of the maxillae, and the palatine, sphenoid, vomer, temporal, and occipital bones. The hard palate, bony palate, is formed by the palatine process of the maxillae anteriorly and the horizontal plate of the palatine bones posteriorly. The free posterior border of the hard palate projects posteriorly in the median plane as the posterior nasal spine. Posterior to the cranial incisor teeth is a depression, the incisive fossa throughout which the nasopalatine nerves pass from the nose throughout a variable number of incistive canals and foramina. Posterolaterally are the greater and lesser palatine foramina. Superior to the posterior edge of the palate are two large openings, the coaine posterior nasal apertures, which are separated from each other by the vomer, as thin, flat, unpaired bones that make a major contribution to the bony nasal septum. Wedge between frontal, temporal, and occipital bones is the sphenoid bone, an irregular unpaired bone that consists of a body and three pairs of processes: greater wings, lesser wings, and pterygoid process. The greater and lesser wings spread laterally from the body of the bone. The pterygoid process consists of a lateral and medial pterygoid plates extending inferiorly and on each side of the sphenoid from the junctions of the body and greater wings. The groove from the cartilaginous part of the pterygotympanic, which is the auditory tooth, lies medial to the spine of the sphenoid. Depressions in the temporal bone, the mandibular fossa, accommodate the condyles of the mandible when the mouth is closed. The cranial base is formed posteriorly by the occipital bone, which articulates with the sphenoid bone anteriorly. The four parts of the occipital bone are arranged around the foramen magnum, the most conspicuous feature of the cranial base. The major structure passing throughout this large foramen are the spinal cord and its covering meninges, the vertebral arteries, the anterior and posterior spinal arteries, and the accessory nerves. On the lateral part of the occipital bone are two large protuberances, the occipital condyles, by which the skull articulates with the vertebral column. The large opening between the occipital bone and petrous part of the temporal bone is the jugular foramen, from which the internal jugular vein and several cranial nerves emerge from the skull. Superolateral to the jugular foramen is the internal acoustic meatus. The entrance to the carotid canal for the internal carotid artery is just anterior to the jugular foramen. The mastoid process is rigid because it provides for muscle attachment. The stalomastoid foramen transmitting the facial nerve, right, and stalomastoid artery lies posterior to the base of the staloid process. The internal aspect of the cranial base. The internal surface of the cranial base has three large distinct depressions that lie at different levels: the anterior, middle, and posterior cranial fossae, which form the bowl-shaped floor of the cranial cavity. The anterior cranial fossa is at the highest level, and the posterior cranial fossa is at a lowest level. The anterior cranial fossa, the inferior and anterior parts of the frontal lobe, frontal fold of the brain occupy the anterior cranial fossa, the shallowest of the three fossae. The anterior cranial fossa is formed by the frontal bone anteriorly, the ethmoid bone in the middle, and the body and lesser wing of the sphenoid posteriorly. The greater part of the anterior cranial fossa is formed by the rib orbital parts of the frontal bone, which support the frontal lobes of the brain and form the roots of the orbit. This surface shows sinus impressions, which are the brain markings of the orbital gyrus of the frontal lobe. The frontal crest is a median bony extension of the frontal bone, and its base is the foramen secum of the frontal bone, which is insignificant postnatally, but gives passage to vessels during development. The crista galli, right, which is also known as the cone, is a median ridge of bone posterior to the foramen secum that projects superiorly from the ethmoid. On each side of the crista galli is the sieve-like crevice-formed plate of the ethmoid. The olfactory nerve, right, the CN1, from the olfactory area of the nasal cavity pass through the foramina in the creviform plate to reach the olfactory bulbs of the brain that lie on this plate. The middle cranial fossa is butterfly-shaped, composed of the large deep depression on each side of the much smaller sella turcica. Centrally on the body of the sphenoid bone, the bones forming the middle cranial fossa are the greater wings of the sphenoid squamous part of the temporal bone laterally, and petrous, which is known as a rock-like part of the temporal bone posteriorly. The middle cranial fossa is posterior inferior to the anterior cranial fossa, separated from it by the sharp sphenoidal crest laterally and the sphenoidal limbus medially. The middle cranial fossa supports the temporal bones of the brain. The boundary between the middle and posterior cranial fossa is the petrous crest of the temporal bones laterally and a flat plate of bone, the dorsum sella, of the sphenoid medially. The sella turcica, the sap-like bony formation on the upper surface of the body of the sphenoid bone, is surrounded by the anterior and posterior clinoid process. The sella turcica is composed of three parts: the tuberculum sella, which is the styrofoam, a slight olive-shaped swelling anterior to the hypophyseal fossa, and the hypophyseal fossa, which is the pituitary fossa, a depression seat of the saddle for the pituitary gland, and the dorsum sella, which is the back of the sella, the saddle, a square part of bone of the body of the sphenoid posterior to the sella turcica. The sharp posterior margin sphenoid ridges of the lesser wing of the sphenoid or behind the middle cranial fossa. The lesser wing and medially in two projections, the anterior clinoid process. The clinoid means bed post, and the four clinoid processes surround the bed of the pituitary gland, which is known as the hypophyseal fossa, like the post in a four-poster bed. In the middle cranial fossa on each side of the base of the body of the sphenoid bone is a crescent of four foramina. The foramina perforate the root of the greater wing of the sphenoid bone. The superior orbital fissure is between the greater and lesser wings. This fissure provides communication with the orbit and transmits the ophthalmic veins and nerves entering the orbit CN3, CN4, CN5, CN6, and sympathetic fibers. The foramen rotundum is posterior to the medial end of the superior orbital fissure. It transmits the maxillary nerve, CN5, that supplies the skin, teeth, and mucosa related to the maxillary bone of the cheek. The foramen ovale is a large foramen posterolateral to the foramen rotundus. It opens inferiorly into the infratemporal fossa and transmits the mandibular nerve, CN5, and a small accessory meningeal artery. The foramen spinosum, posterolateral to the foramen ovale, transmits the middle meningeal vessel and the meningeal branch of the mandibular nerve. The foramen lacerum, not part of the crescent of foramina, is a raised foramen that lies posterolateral to the hypophyseal fossa. It is an artifact of a dry skull. In life, it is closed by a plate of cartilage. Nothing is transmitted vertically through the foramen lacerum. The internal carotid artery and its accompanying sympathetic and venous plexuses pass across the superior aspect of the cartilage, and some nerves transverse the cartilage horizontally. Extending posteriorly and laterally from the foramen lacerum is a nerve root for the greater petrosal nerve on the anterior surface of the petrous part of the temporal bone. There is also a small groove for the lesser petrosal nerve. The posterior cranial fossa. The posterior cranial fossa, the large and deepest of the three cranial fossae, lodges the cerebellum, the pons, and medulla oblongata. The posterior cranial fossa is formed largely by the occipital bone, but the dorsum sella of the sphenoid marks its anterior boundary centrally, and the petrous and mastoid part of the temporal bone contribute its anterolateral wall. From the dorsum sella, the clivus is a mark inclined in the center of the anterior part of the posterior cranial fossa, leading to the foramen magnum. Posterior to this large foramen, the posterior cranial fossa is partly divided by the internal occipital crest into two large concave impressions. The cerebellar fossae. The internal occipital crest ends in the internal occipital protuberance, formed in relationship to a merging of throat venous sinuses, the confluence of the sinuses. A broad groove shows the horizontal course of the transverse shaped sinuses at the base of the fetus crest. Of the temporal bone is the jugular foramen, which transmits several cranial nerves in addition to the sigmoid sinus, which exceeds the skull at the IG5. Anterosuperior to the jugular foramen is the internal acoustic meatus for the facial and vestibulocochlear nerves, the CNA, and the labyrinthine artery, the hypoglossal canal for the hypoglossal nerve, CN12, is superior to the anterolateral margin of the foramen magnum. Walls of the cranial cavity. The walls of the cranial cavity vary in thickness in different regions. The walls are usually thinner in females than males. Right. And we see over here the thinner in children and elderly people. The bone tends to be thinnest in areas that are well covered with muscles, such as the squamous part of the temporal bone and the posterior inferior part of the skull posterior to the foramen magnum. Right. Most bones of the calvaria consist of internal and external tables of compact bone, separated by spongy diploid. The diploid is cancellous bone containing red bone marrow during life, throughout which run canals formed by diploid veins. Right. Let's just continue, right, with the next session shortly. Let's take a deep break. Take a deep breath and take a break of 10 minutes. We'll be back soon.